Hello and welcome to the Multicultural Media online conference hosted by the Ministry of Health, Multicultural Health Communication Service and Multicultural New South Wales. I'm Jesusa Helaratne, Deputy Director of the Multicultural Health Communication Service, and I am your moderator for this session. Today we have with us, as always, our Senior Medical Advisor from New South Wales Health, Dr. Jan Fizzell. Nice to see you again.
Hi, Jess.
And we have joining us this afternoon a special guest, Dr. Clinton Colaco, Westmead Hospital Infectious Diseases Advanced Trainee, who will provide information on travel-related illnesses and gastrointestinal infections. And it's really important for us to know, especially for people who are traveling and planning to travel overseas. We'd like to begin by acknowledging the traditional owners of the land on where we are all meeting from today. For Dr. Jan, Dr. Clinton, and myself, we acknowledge the traditional custodians of the land, the Camaragal people of the Eora Nation. We pay our respects to elders, past and present, and extend the respect to Aboriginal colleagues and elders. We also acknowledge the multicultural community, leaders, and elders who are joining us in this session. And thank you very much for keeping your microphones on mute. As always, as we only have 30 minutes, we'd love for you to ask your questions on the chat, and we'll get them answered by Dr. Clinton and Dr. Jan. And our colleagues from the Multicultural Health Communication Service will also put some links onto the chat for you to use for your publications and broadcasts. So we'll start. Dr. Jan, how are you and what are the updates for today?
Thanks, Jess. So today we're reporting 6,690 positive test results. So just under 7,000 people reported with COVID. We've had, sadly, 14 deaths of 10 men and 4 women, and our condolences to those families. We have just over 1,800 people in hospital with 38 in ICU. So the good news is our numbers are starting to come down, but COVID is still amongst us, so we still do need to stay careful.
Thank you, Dr. Jan and Dr. Clinton. Thank you so much for joining us.
Thank you.
Any updates, and why is travel and alerts and updates important for us to know?
Yeah, thanks. It's a very important question. So everyone is traveling at the moment. Everyone wants to get out. COVID's kept us locked down for quite some time, and there are countries overseas that have opened up and people are visiting. So a lot of people are visiting Asian countries, including India, Pakistan, Bangladesh, Africa, the Caribbean, Central and South America, a lot warmer than it currently is in New South Wales. And so it's important that we actually protect ourselves against infections that could cause us quite a great deal of harm, as well as harm to our families. So it's really important that we are aware of these infectious diseases, as well as protect ourselves. And there are several things that we can do.
Dr. Clinton, what are these diseases that that are common to travelers?
Yeah, so there are many diseases. Some of the more pertinent diseases at the moment are things like enteric fever, which includes diseases such as typhoid, as well as paratyphoid. In terms of people going to Southeast Asia, there's a lot of malaria that can come through, as well as dengue fever. There's also quite a large variety of gastrointestinal diseases, such as salmonella, but not limited to things like E. coli infection or Shigella. And more concerningly, people that get these kinds of infections from overseas, they can be quite resistant to first-line antibiotics. So therefore, we really need to make sure we try and prevent these infections from occurring, and are well equipped to treat them if they do occur.
Thank you so much, Dr. Clinton. And Dr. Jan, adding to COVID-19, this is a serious matter as well, these infections and diseases.
That's right. And I think that's what we're really learning is if we're traveling, COVID is still out there overseas as well. And in some countries, you won't see the same level of mask wearing, or you might see more mask wearing. But the things that we've learned to do here will help keep us safe overseas. It's also really important that we keep our COVID vaccinations up to date, make sure that you're up to date for you and your particular health conditions before you go. go, as well as your flu vaccine. If you haven't had it yet, we're going into the Northern Hemisphere winter, and our flu vaccine from here will give us hopefully some coverage against those strains in the Northern Hemisphere. And then there are also other vaccines that you might like to have before you travel, depending on your destination. And the key thing will be about talking to your GP before you go, because even if it's your home country that you're going back to, there are some vaccines that may have been developed since you were little, since you were last there, that may help protect you against things that you won't be protected. Or else if you've got kids who are born here in Australia, they won't have been exposed to those illnesses necessarily when they're traveling. And so having that protection before you go can also help. So it's a good idea to see your GP a number of weeks before you're actually getting on that plane to make sure that you've got time to get all of those things in order.
Thank you, Dr. Jan. And Dr. Clinton, what are those vaccinations that we should be preparing for, aside from COVID, when you're traveling?
Yeah, thanks, Jess. It's a great question, and I wanted to answer that specifically because just earlier today I got my typhoid vaccination, and so I might be traveling to India in January of this year, and so the typhoid vaccine only lasts for 3 years, and so it's important that you do refresh it. And it's for most people, they haven't gone overseas for almost 3 years, so typhoid is one of them. Other things include Japanese encephalitis, so that's a pertinent disease at the moment. Yellow fever, particularly if you're going to the Caribbean or areas like Brazil. Most people should have had things like a polio vaccine, which is part of the DPT schedule. So that's another important vaccination. And not only vaccination, but there are tablets, pills that you can take for other diseases to prevent things such as malaria. But it's important, as Dr. Jan mentioned, to really consult your local GP or a travel medicine doctor about the specific requirements that you have, because every place is different, and particularly with something like malaria, where you go matters in terms of what kind of prophylaxis or prevention strategies you need to take.
Thank you, Dr. Clinton. For those watching us, please make sure that you ask your questions, and we have great experts here to answer all those questions that you may have. My question is, you said to go to your GP. Should you be visiting, should you make it a habit to go to your GP before you travel and after you travel? Because there are infections and diseases that travel out shared when you come home.
So I think the key thing is, yes, it's always worthwhile going to your GP before you travel. So it can be things like making sure that you've got your prescription medicines and you've got enough for when you're traveling, that you've got a letter from your GP, because some of the medicines that we have here in Australia, if you travel overseas with them, they may be considered dangerous or a problem. So if you've got a letter from your GP, you can show that you're legitimately carrying those medicines overseas. The same medicines may not be available overseas, so making sure that you've got the right medicines in the right quantity for when you're traveling. Also, again, all those things that you might need to do for you and yourself, what are the vaccinations? And also having a chat to your GP about mosquito prevention is also a really important thing. But I think Dr. Clinton can probably say more about that.
Yeah, sure. Thanks, Dr. Jan. So look, we've talked about vaccinations. They're very important, and they've definitely come to the fore in terms of COVID times and looking at the whole post-COVID sphere. But it's important to recognize that there's other preventative measures that we can take. And that includes, for example, if it's preventing yourself against foodborne infections, to make sure that you avoid, for example, in places like India and Pakistan, tap water, or having ice that's just from the tap. Try and have boiled water or filtered water. That's really important. Try and avoid street food or food that you haven't prepared yourself, or uncooked foods. I learned something new very recently, but it's important that you only eat fruit that you can peel. So things like oranges or bananas, they're actually are much safer for you. And if you are eating out, just make sure you wash your hands. These simple messages that we've become accustomed to in the last few years still apply overseas. So wash your hands with soap and water. It's actually better than hand sanitizer, particularly for certain infections and preventing those. So those are the main preventative things from a foodborne perspective. And as Dr. Jan alluded to, mosquito-borne viruses are rampant in places overseas. So taking things like mosquito repellent, as well as using mosquito nets, all of these measures are very important to keep yourself safe and your family safe.
I was just going to ask that. What are you supposed to bring with you when you travel? We have this habit now that we have a bag with our mask, with our sanitizer, and other extra masks. What should we be preparing as a kit when we travel to avoid any of these diseases?
Well, I think some of the things that we can take from here are really good mosquito repellent is one of the key things that we should take with us. Things like oral rehydration salts, so things like Hydrolyte, and there's lots of other ways. And if you can take them in tablet form with you, that's easier and compact. And that way, if you do get gastro, you've got something that you can sip on to rehydrate yourself. Also, things like if you're not going to be able to boil your water, either water purification tablets, or you can also get these little UV pen filters that can help get rid of bacteria when you're traveling. If you've got kids, thinking about what they're going to tolerate as far as things go. So thinking about if they're not going to let you put the repellent everywhere, about long sleeve clothes for them, even if it's hot, if they can wear, a long sleeve shirt and long sleeve pants, that can help give the mosquitoes less target practice, shall we say. But also just, again, thinking about your medicines, thinking about those medicines that you don't use every single day, but you might use occasionally. And then talking to your GP about whether you need to take some antibiotics with you, depending on where you're going and what your risks are, and having your GP talk you through what those are. And also talking about medicines that may help with symptoms of gastro. So
yeah, so look, GastroStop is something you can get over the counter and can be quite useful, but it's just important to make sure that if you do get really, really bad symptoms, that you do seek help, because sometimes taking things like GastroStop may not be entirely beneficial and maybe masking something sinister. So it is important to seek help early as well.
Thank you, Dr. Clinton. And Dr. Jan, one of the things that people don't realize, and based on the information that I've read, is that young kids, when they have traveled from overseas and they meet other kids, that could be passed on, the infections.
Yeah, so kids are not known for their great hand hygiene. So we can see one of two things happening. One is when kids go overseas themselves, as I say, adults might be fine eating everything, but the kids guts aren't used to it, and so the kids can get sick. The other thing that can happen is people travel to Australia from overseas and are visiting with family members, and they may not know that they've got something, and it can spread in the family. So it's important to tell your GP if you've got someone from overseas that's been spending time with your family, so that your GP isn't just thinking about Australian bugs, they're thinking about bugs from where you've been, so that they can think about what the right treatment, or whether it's worthwhile capturing a poo sample to check what you've got going on. So that can change your management if they know that you've got a different risk compared to somebody who's just in the community at the moment.
So does that mean that it's really important? Should you be telling other people when you're visiting them, and look, I've just come from overseas, and is that something that a regular thing that we should be doing now?
I think if you're a crook, hopefully you wouldn't be visiting them, because we'd still say if you've got germs, even if this is your best friend or your great uncle or the person that you haven't seen for forever, spreading germs is not a great welcome mat. So I would really suggest that if you're unwell, don't go visiting. But the fact is that if you have got someone, and say you've been with them yesterday and you get crook today, letting them know that if you get crook, I've been crook and I've just come from overseas, is probably a kind thing to do. A bit like we do with them.
Yeah.
Yeah, look, I'd agree. And I'd take that one step further and say, if you do then seek hospital advice, make sure you tell the doctor or the nurse that's looking after you very early that you've been overseas and where, because it really helps people like me that work inside these hospitals from an infectious diseases perspective to actually say, well, look, you might have this or you might have this. And that's kind of what I did today, actually. So it's important to disclose that information so that, we can think along those lines. Yeah.
And also, I guess, it is dependent on when you're traveling, where you're traveling. That's important too. We have a question from Russell Anderson from NEMBC Media. Can you get dengue fever in New South Wales? He's asking, it used to be confined to the north of Australia, but it seems to be spreading within Australia. And can you bring back dengue fever to Australia? Dr. Clinton.
Yes, yes, you can get dengue fever from overseas, and it is something that you can find in Southeast Asia and South Asia as well. So yes, that's correct, and we don't have, as far as I know, any locally acquired dengue fever cases. And dengue fever, like many other illnesses, presents with very broad sort of non-specific symptoms. Could be COVID these days, could be the flu or another respiratory infection. But if you have been overseas and got things like joint pain and fevers and muscle aches and pains, well, it could well be dengue. And especially if you've got that history of a mosquito bite, you know, we're going to be thinking along those lines.
I guess the concern of many people is if they've been sick with COVID, will it be worse if they have other illnesses?
Look, I think some people who've been incredibly sick with COVID, you know, if they've had the lung inflammation and everything else, having a second illness is not great. But I think generally speaking, it's good to prevent any of these illnesses from happening, because they do all have, you know, our immune system's got a limited repertoire and how it can tell us something's wrong. It makes us ache, it gives us fevers, it makes our headache. And so that's why a lot of these illnesses quite early in the course seem to all look, you know, the same. But the key thing is giving that good history to your doctor about where you've been, why you've been there, what you did while you were there. Did you get bitten by mosquitoes? Was anyone else sick that you were traveling with? It really can help a doctor work out, well, no, you haven't got COVID because your PCR was negative. You haven't got flu, the PCR was negative, but you've been somewhere. That means I need to look deeper into your case.
Yeah.
Sorry, just to add, some of these diseases, particularly dengue, for example, you don't want to get twice. COVID, a little bit different to COVID, but dengue the second time around is 10 times worse than dengue the first time around. And we'll be very vigilant if you have given us that history of dengue before. So you do want to prevent these diseases from the get-go.
And from these diseases, we've got this question before, Dr. Jan, where can your other illnesses be enhanced? Like, for example, would you have high blood pressure more? I mean, those are some concerns, health issues and concerns.
So certainly some of these viral illnesses can, if particularly people with autoimmune diseases, they can cause a flare of those autoimmune diseases. If you've already got problems with your lungs and you get an illness that causes more problems with your lungs, it's not good. So basically, if you've got underlying chronic illness, putting an infectious disease on top of that is not a great thing. So that's why people who are, particularly people who are on immunosuppressants, so we talk about this with COVID, about people who are on treatments for their rheumatoid arthritis, for their Crohn's disease, so they've got some level of immunosuppression. They need to be particularly vigilant around travel, because they need to make sure that they know, you know, is there a local outbreak? Should I be careful? You know, do I go out to a restaurant in the evening when the mosquitoes are biting, or do I save my, you know, my travel food adventures for lunch, that sort of thing. It's about being aware, I think, for people who are at higher risk, being aware of the fact that they are at higher risk and the fact that they do need to be that little bit more vigilant, and just taking care of your traveling party as well. If you've got someone in the travel party that's like that, or, you know, is immunosuppressed, so that you don't put undue pressure on them to go with the flow, I think.
Yeah. And I think what you said earlier is, you know, when you travel overseas to hot places, hot weather, you actually don't bring long sleeves, you bring short sleeves, but in actual fact, you're saying travel wisely.
Exactly. And so again, if you're immunosuppressed, you know, you'd want to be wearing long sleeves to give those mosquitoes less of a chance of getting to you. And, you know, you may even select your travel destinations. I know that people without a spleen, for example, are very much advised not to go to very high malaria prone areas, simply because if they get a problem, it's much harder for, you know, they're much more likely to get very sick.
Let's go to COVID, Dr. Jan. We talked about being sick with COVID, but there's these people concerned about long COVID, and it's still very much a concern.
Look, and I think that's reasonable for the community to be concerned because we're still learning. And I think that's the really key thing. It feels like we've been living with COVID forever, but really it's been an international phenomenon with lots of people getting sick for only 2.5 years. In the School of Medical Research and Understanding of a Disease, and particularly its long-term effects, we're still, in our very first infancy. The key thing is, though, I think if people are still unwell, having recovered from COVID, got over their symptoms, is to talk to their GP, because it could be something else. They could be saying it's just long COVID, and it could be you've got anemia from something else going on. It could be that you've got, a thyroid problem. There's other things that, you could have going on that can give you symptoms that people would say, well, brain fog, not feeling themselves, being out of energy. There's other things that can be causing those. And it may be that COVID's unmasked some of those other things that were going on with you anyway. It's just that when you stopped, you actually really realized that you weren't feeling great in the first place. So really important that you check in with your GP to make sure there's nothing else going on and they can give you some support.
Thank you, Dr. Jen.
Yeah, just if I could add to that. Yeah, I just came back from a presentation, and essentially I know of this patient that had COVID and recently had a couple of other diseases found in the course of or the post course of their COVID, which is very strange. So it could unmask latent infections of all sorts, like I've mentioned, and others. So it's important to do get yourself checked out if you got signs or features of fevers or just feeling unwell, because there could be something else going on.
And if you are, for example, immunocompromised or have had these diseases that you mentioned, you could be more prone to other illnesses.
And that's the thing. It may not be COVID. It might be something else. And for example, with flu, if we get you early enough, we can treat you. If we have other things going on, often there's a treatment. So I think it's really important that we don't just write it off and say, oh, it's long COVID. We do need to get you. And for some people, it will be. And again, we're seeing different clinical trajectories for different people. We're seeing some people are getting better. Some people might not be getting better. It could be, COVID could be giving us systemic inflammation that causes problems in the months after COVID. So it's still a new disease. We're still learning, but it's also, if we keep our vaccinations up to date and we keep wearing our mask when we're in crowds and we avoid getting it, even if we've had it once, we can reduce our chances of those poor outcomes into the future.
Thanks, Dr. Jan. And we know that in some communities, some people are still concerned or are not convinced to take the vaccination. What's the key message for, how can we start our conversations?
Look, I think the thing is we've now got billions of people who've had these vaccines. We've got really good safety data about the vaccines now. They're not new. They're things that we've got good experience at. And a lot of the things that people were really worried about have not been manifest. It can't change your DNA. It can't make you sick. It doesn't make you more vulnerable to other illnesses. It's, all those things that people thought would happen. The thing I hear now is, well, that person had 2 doses of vaccine. Why did they get really sick? And the answer is because we've learned that you don't just need, especially if you're over 50, you don't just need 2 doses of vaccine. You actually do need to keep up with the boosters and the recommendations, just the same as if you had a tetanus vaccine when you were a little kid and you didn't get a booster when you had a big cut on your hand. You couldn't say, well, the tetanus vaccine as a kid didn't work, because we know that you need to have booster immunisation. So it's the same with this. So the thing is, keeping up to date with immunisations reduces your chance that you're going to be one of those people in ICU, or that you're going to be one of those people who's really crook. And so it may not eliminate that chance, but it certainly reduces it. And, it was my sad duty for a long time to be looking at the deaths in people under 65. And most of them were not up to date with the recommended vaccines for a person of their age and health status. So even if they'd had 2 doses, they might have been a transplant patient who should have had 5 doses by that point. So staying up to date with your immunisation is incredibly important.
You talked about boosters and additional vaccination. Is there a chance that there will be?
Look, I think we will expect that at some point there'll be a newer, better vaccine for COVID. And that when that happens, we'll get a new set of recommendations. At the moment, we've got experts who are constantly reviewing what's happening with the situation in Australia, what information are we getting from overseas, and what is the best thing to recommend to Australian people, which is why we've got different recommendations depending on how old you are and what your health status is. And I think that's really important that people understand that we're not just saying everyone go and get as many vaccines as possible. The answer is there's different vaccination regimes for people, age and health status.
And that's the same for vaccinations for other infectious diseases, isn't it?
Yeah, so like I alluded to, so for example, a typhoid vaccination only lasts for 3 years. A tetanus vaccination only lasts for 5 years. So you do need to get yourself boosted or be up to date. Yeah, there's plenty of vaccinations for other diseases, including things like hepatitis A and others that we've alluded to today. Yeah.
Thank you, Dr. Clinton. And all those resource information are on the New South Wales Health website, and you've seen some of the links on there. And we've also shared posters on antivirals as well that's available that you can put up on your agencies or organizations. But a question, Dr. Jan, that's coming up as well. There's a new strain. Will there be a chance? Are we seeing new strains of COVID?
So we monitor for new variants of concern. I say we're certainly sequencing some people who are really critically ill all the time in New South Wales, but also internationally. There's constant monitoring of the strains. What's happening? Is there a new strain that's either more infectious, or is there a new strain that past vaccination or immunity is not protecting us from, or is there a new strain that's causing a whole lot of, really serious illness? That's all being watched all the time because we've got a number of, labs around the world doing sequencing of COVID, and the World Health Organization is watching carefully all this information. Our clinicians watch carefully and get intelligence from doctors in other parts of the world constantly to find out what's going on. And so if there is a new strain, we'll hear about it. I would expect that there will be a new strain. That's now been the history of COVID. Fortunately, I don't think we've had anything. We've had subvariants of Omicron really, but we haven't had the next big Greek letter, if you like, happen yet. So I think we can all... Like Delta. Yeah, so, and the fact that Delta didn't give us a lot of protection against Omicron, and that early Omicron infection didn't give us a lot of protection against later Omicron. Some protection, and some people, had really good protection, but not everyone. So I think it's that key thing that we're just going to have to keep watching and learning. But COVID has learnt that, it moves with humans. It can only spread when humans are together. And so the more we're together and the more we're moving around, the bigger the chance that we're going to see something else emerge.
Thank you, Dr. Jan. And Dr. Clinton, your role as an infectious diseases expert, it's quite an interesting role because you're finding new things. Could you tell us just a bit about how that happens and what you have to do to make sure that you're up to date with all these information?
Yeah, that's a very tough question, and we have to do a lot. We have to continually read, listen to our colleagues, hear what their concerns are overseas. Keep up to date with funnily enough, a site called Up to Date, and read through some medical journals and see what people are publishing around the world and overseas. But yeah, look, like Dr. Jan was mentioning, our colleagues in microbiology, where I'm currently sitting in, they're looking at variants of concern or of interest and subvariants and whatnot, looking at reinfection rates. So, they're sharing that information, and everything's about sharing of information so that we can understand what's going on and that everyone else can understand what's going on.
And I think evidence is so important in this day and age where we're also finding out, as you mentioned, you're looking at deaths, you're looking at who's getting vaccinated.
And I think that's the key thing, that we don't just make stuff up, and we're transparent. So we're out there every week with a report on what's going on in the New South Wales community. The genome sequencing people, as soon as they're sequenced, they get uploaded to an international database so people can see not just what we've got here, but, where it connects to in the world. So we've a number of times we've actually found outbreaks in other countries before those other countries by testing return travellers and sequencing it. And then later on, that country is known to be the source of that particular sequence. So it's been a fantastic effort by a lot of people who've worked really hard under a lot of pressure for, 2.5 years now. And the pressure doesn't let up because, we've had COVID, we've then had the JE and Japanese encephalitis incursion. Now we've got monkeypox. So I think, we know that with climate change, the diseases are moving and changing where they are. The mosquitoes are moving and changing where they are. People are traveling to new and different places, which is absolutely wonderful, but it's also a bigger chance that somebody's going to bring something home with them. And so that's why it's so important that if you do get sick after you've been away, or even if away is home for you, so you may not have travelled for fun, you may have been travelling with family, doing the same sorts of things that were normal for you to be doing 10, 15 years ago, you could now be exposed to things at home that weren't at home before. And then when you come back to your other home in Australia, you can bring those things with you. So it's just really important just to be aware that even the nature of travel and, experiencing new cultures, new places, or going back to old culture and old places, you can bring new things with you.
Thank you so much, Dr. Jan. And Dr. Clinton, what Dr. Jan said, you may have grown up somewhere else, but when you travel back, it just may be a different experience, and you may just get something that can make you get sick.
Yeah, that's quite right. Most, like, for example, my parents were born overseas. They've been in Australia for many, many years, but it's not the same. If they go to Africa or they go to Pakistan, it's a different story. They need to get vaccinated. Everyone should get vaccinated and take preventative measures, because what someone might have done for 20 to 30 odd years overseas is not something that you can do now at all, and you could be susceptible to these infections. Yeah.
Thank you so much. And any last message for the media and for them to be sharing to their networks and community?
Yeah, look, I think this is a very generic message, but it applies whether it's COVID or overseas acquired infections. But be cautious, wash your hands, get vaccinated, and seek help if you're unwell. I think those are the most important things.
Thank you so much, Dr. Clinton, for joining us, and Dr. Jan. Any last?
And look, just to say, it's such a fantastic time to be traveling again. And I think with lots of family festivals and things coming up, it's a great time to get together. So please just be careful and keep your germs to yourself. If you've got something when you come back, don't share them.
Thank you so much, Dr. Jan. And thank you to everyone who's joined us online for joining us here on the Multicultural Media online sessions. And we'll be back again on September 7th. And that day will be Multicultural Health Week. So we'll be sharing the key messages, and the theme for that week is cancer screening. So we'll see you again in a fortnight. The recording of this session will be available on the New South Wales Multicultural Health Communication Service website, and we'll send that through to you, as well as some resources you can share. So have a good afternoon, and thank you again. See you next time.